welcome to our channel, All Health. I'm your nutritionist, Wenxin.
I'm your dietitian, Jeremy.
Jeremy, is still March and we know
Yes.
that the 8th of March is International
Women's Day.
Yeah, we know we celebrate women's promotion items and also
Yes.
we create awareness for gender equalities
Yes,
and also
correct.
women's rights. But also we have to mention about some health issues related to women, which is
Urinary Tract Infection, or more commonly known as UTI, alright? Now, we all know that UTI doesn't have gender discrimination.
Yes.
But the thing is, this UTI seems to favor ladies a little bit more. Yeah, it's quite common among ladies compared to men.
Yeah, and our title today is the unspoken truth. Why? Because we know for centuries, women we have a lot of unspoken illness. Maybe due to in previously we have the gender inequalities. Like
Yes, correct.
women have to hide their face, they cannot show off their body parts. So when they have certain issues, they do not dare to go to clinic to meet doctors to know what is their problem. So that's why many issues, for example like UTI, is hardly treated and managed well by women.
Yes, correct, and it's always about toilet problems, okay? It's about urination. Probably they feel a little bit confused or embarrassed, and then they don't want to reveal to others, not even to the family members. And only then, when the symptoms become very severe or there are those complicated cases, that's where they have no choice but to seek advice or medical treatment from doctors.
Yeah, because we know that our urinary system is quite close to our sexual organs. So some
Yes, correct.
women, they might think that they have sexual transmitted issue. That's why they are very shy to embarrass to voice out this problem.
Yes, but the thing is, UTI is actually very common, and the global prevalence worldwide is about 10 people for every 1,000 people. All right, and it affects women more because 50% of women experience UTI at least once in their lifetime, and about at least 20% of these people experience actually 2 or even more recurrent UTIs throughout. That means they keep having this UTI, and this UTI keep coming back and go, coming back and go. So that's why they get very frustrated, irritated with all these signs and symptoms.
Yeah, we have a news here why UTIs happen differently in men and women. Because just now Jeremy mentioned that women are more prone to UTI.
Yes, correct.
But what is the reason behind this? So we have to look closely into our urinary tract system.
Yes, correct. So when we see the anatomical structure of men and women, why UTI seems to affect women more is because when you look at this diagram, on the left is the male urinary tract organs, and the other one is the female urinary tract system. So you can see the structure comes with the ureter, the bladder, and the urethra. And you can actually see that women actually have a shorter urethra compared to men. Men is about 10 to 15 centimeters, but women is only about 1 to 2 centimeters. So which is actually very short. And because the urethra is very close to the vagina, the anus, so that seems to be an easier way for those bacteria to escape and enters through the urethra.
Yes, so generally urinary system, no matter it's men and women, can be classified into two, the lower and upper part of the system. So the lower part actually consists of the urethra and bladder, and the upper part consists of ureters and kidney. So how our urine forms actually is from the kidney. The kidney filters the blood in our body and then it secretes out the waste product named as the urine. So the urine will travel through the ureters stored in your urinary bladder. And when your bladder is full, then you have the urge to go to pee. That's why when the urine will flow out from your body through the urethra in the toilet.
Yes, correct. So when we talk about UTI, UTI meaning the infection or inflammation that happens in any part of the urinary tract. For example, let's say if it happens at the urethra, it could be urethritis, or if it is the bladder, or it's going to be the kidney, pyelonephritis. All right. So in any case, if it happens just at the urethritis, right? So it's going to be something. What we say as uncomplicated, it can be treated easily. But if let's say there's something, the infection goes up to the kidneys, where it can actually trigger a lot of complicated diseases, including acute kidney injury or acute kidney failure.
Yeah, so actually generally our body has a mechanism to prevent the black backflow of the urine.
Correct.
Like it will travel through the kidney downwards to the urethra. But when some things happen, maybe maybe body structure is different and some disease or some diet and lifestyle changes, it makes you more prone to getting this UTI.
Yes, and talking about these lifestyle factors, okay, there are some people that like to host their urine. Sometimes they like to, they have some preference to specific toilets, okay, or they are very concerned about the hygiene of the public toilet. So when they go out, they don't use the public toilet and they actually hold the urine all the way until they get back home. And imagine if you hold the urine too long, right? So this urinary bladder will be full, okay, when it's exceeded the capacity, and the urine will tend to backflow. So it backflow to the kidneys. So if let's say the urine is already contaminated with the bacteria, and what will happen is you actually bring this contaminated urine back into the kidney and trigger even more inflammation or even the infections. So it is very important to look at the number one, the lifestyle factor, that is don't hold your urine. When you need to let go, please let it go.
But I remember when we were in a primary school, I know that at that age we are afraid of teachers, so we don't dare to raise our hand and go to the toilet. That's why we have a habit of holding pee.
Yes. And even when children, when talk about going to toilet alone, there'll be a lot of these fear factors, and probably they don't dare to go, so they actually hold the urine. So these are also one of the reasons why children can also get UTI if they actually don't let go or pass urine consistently.
Yeah. So how do we know that we are getting UTI? There's a lot of signs and symptoms we can identify. So the first one will be pain or a burning sensation when peeing. I guess that many people have this experience.
Yes, imagine when you eat mala hot pot, right? There's some tingling sensation in your mouth, and then as it enters your esophagus, you feel the burning sensation, even in your stomach sometimes. But imagine when you pass through urine, alright, there's also a tingling sensation or burning sensation. Okay, this is actually what happens, alright, like if you actually have a UTI.
Yeah, and also increased urgency of urination and frequent urination without passing much urine. So you feel you have to go to the toilet a lot of times, even at night. And
yes, correct.
Some people, when they sit down at the bowl of toilet, they couldn't pass even a drop of urine,
yes,
or
correct.
just a little urine.
Okay, why is it so? Because when it comes to the infections, okay, there could be other reasons. For example, enlarged prostate. So in men, for example, so when there's an enlarged prostate, there's an obstruction or to the urethra, so it's very difficult for the urine to pass through. So that's why you have the urgency. Okay, your bladder is full already, but it just doesn't pass through. So that's where you only pee very little. Yet again, the urgency will come back. Probably some person, they have to wake up like 2 to 3 times at night, okay, just to go to the urine, but they cannot pass urine completely.
Yeah. Next one, we have cloudy, bloody or foul-smelling urine. So normally our urine, the color will range from light to maybe
pale yellow.
Pale yellow. But when your urine starts to have abnormal color, cloudy or even blood, and the smell is really bad smelling.
Yes, correct.
That could be one of the indicators that you might have been infected.
Yes, correct. Sometimes when you go for the lab test, okay, they will actually do something called the urinalysis. That means they analyze the urine sample, and from there they can actually determine whether there are any presence of abnormal cells, okay, including white blood cells, including red blood cells. Okay, for your information, our urine should be sterile. Okay, sterile meaning that there shouldn't be any presence of living cells or any cells debris in the urine. All right. But if let's say if the presence of red blood cells or even the white blood cells are very high, it could be an indicator that there is already a leakages and also the infection in any parts of your urinary tract system. That's why causing the cloudiness or even the foul smelling.
So some they even will do the urine culture to identify what types of bacteria are being infected. So they could prescribe you the suitable antibiotics.
Yes, talking about the bacteria, okay, there are actually many types of bacteria that can contribute, okay, to the UTI, and the most common will be something called the E. coli. Okay, E. coli actually contribute about 65 to 75% of the UTI incidence, but for the rest, it could be coming from other bacteria types or even the fungi types.
So next, for the symptoms, we have pelvic pain in women and growing pain in men. So actually, men can also get pelvic pain, especially when you have infection in your kidney.
Yes, correct.
That's why you have the pain in your maybe lower back, the pelvic area.
Yeah, so because when we say pelvic pain, low back pain, you know, it's very what we say, it's a grey symptom because it could actually relate to many different types of health issues. So you have to actually combine with other symptoms, okay, signs and symptoms, and if you are in doubt, always remember to seek advice from your physician.
Yes, next we can proceed to pain and tenderness in upper back and sides. And then lastly, chills, fever, nausea, or vomiting.
Yeah, so these are more of the complicated type of UTI where there are already signs and symptoms that appear, and that's why having all these fever, nausea, and even vomiting. Alright, so if you have any of these signs and symptoms, again, don't be your own doctor. Okay, if you are in doubt, okay, please seek advice from your doctor to get the most appropriate diagnosis and of course the treatment. Okay, if let's say you really have UTI, because UTI is something manageable and it can actually recover pretty fast, okay, with the course of antibiotics. But if you drag it very long, if you do not seek immediate medical assistance, it can actually lead to complicated UTI.
Yeah, just now we have gone through the symptoms. Now we want to know what is the risk factor.
Yeah, who are at risk of having this UTI?
Yeah, the first one is poor personal hygiene.
Yes, so this poor personal hygiene, remember just now when we mentioned the anus is very close to the urethra, right? So there's a saying that when you, after you have done your big business, okay, your poo-poo, okay, make sure you have to wipe your backside upwards. Okay,
from the front to the back.
Yes, from the front to the back, because we do not want the feces, okay, because feces are those actually with those bacteria, like for example the E. coli, okay. Imagine if you go it the other way around, so you are actually inviting, okay, those bacteria from the feces to enter to the urinary tract. So we do not want this to happen. Remember, from front to the back.
Yeah. The next one, pregnant and even menopause women, because we know menopause, hormonal changes in our body will increase the risk of getting UTI. For example, like menopause, we have a lower estrogen level, and a lower estrogen level actually linked to the increased higher risk of getting UTI. And also for pregnant women, because they have baby, is very heavy, they apply pressure on the bladder, on the urethra. That's why they will cause some obstruction of the urine flow throughout the body.
Yes, correct. And that's the reason why some pregnant mothers at the later stage of the last trimester, they tend to have urinary incontinence as well. So there are a lot of these complications that can actually increase the risk of getting the UTI. And next, we have actually the diabetes or even the weakened immune system. So we know that these two groups of people, especially for diabetics, if they actually have uncontrolled blood sugar level, it can actually lead to something called the nephropathy. Okay, nephropathy meaning it damages the nervous system. So even including other diseases, okay, that relates to the nervous system, okay, like for example Parkinson's disease, Alzheimer's disease. So these actually damages the nervous system. So when it damages the nervous system, it actually what we say damage the control of the bladder. So there will be some difficulty when you do not know when you should go to the toilet, okay, when you should actually need to pass urine. So there's a tendency for you to hold the urine. So that's why it actually increases your risk of getting UTI.
And also for diabetics, people they almost always have the higher concentration of glucose in their urine, which is a very favorable environment for the bacteria to flourish.
Yes, correct. And talking about this diet with glucose, okay, even some studies they have shown that if people tend to eat a lot of meat, okay, or animal products, okay, we know that eating too much of animal foods or animal food products can actually make your urine more acidic, okay, and an acidic urine is actually a more favorable environment or more conducive environment for these bacteria to grow. Alright, so if you are a carnivore, it's time for you to do a little switch, okay, and we'll explain to you why plant-based diet will be a better choice for you.
It won't kill you to eat some greens.
Yes, correct.
Even red, orange.
Correct. So the next, actually, we have conditions that make it difficult to fully empty the bladder. For example, as what we mentioned just now, an enlarged prostate, gland in men, and of course, constipation in children. So we all know that children, as we mentioned previously, they tend to hold the urine, or because they have the constipation, they do not know how to voice out, okay, their concern, okay, and they actually have what we call as the fecal impactment. So imagine if there's a fecal impactment that will actually put a pressure on the urinary tract system as well. So it sort of actually increases the risk of getting UTI.
Yeah, and also talking about this prostate gland, actually this prostate gland have a protective function to prevent UTI. Why? Because prostate will secrete fluid.
Yes,
this fluid will help
fluids.
to coat the urethra, and this it can prevent the bacteria. And this fluid actually has an antimicrobial
properties.
Yeah, so it kills the bacteria that come attached to this fluid.
Yes, correct. So that's where for women, if let's say they are using these protective equipments, but normally we advise avoid using those with spermicide, because when you use spermicide, it will actually kills and alters the pH of the seminal fluid, and it actually destroys the protective factors, okay, in the seminal fluids during the sexual intercourse.
Yes, the next one, urinary tract obstructions or blockage, such as an enlarged prostate and kidney stones.
Yes.
So we know kidney stone form in the kidney, and the stone can travel through urethra, and also when there's obstruction in any part of your urinary tract system,
yes, correct.
then there will be a stagnation of the urine, which can cause the bacteria to duplicate and
yes,
flourish.
correct. Just imagine if let's say your the monsoon drain, the longgang is clogged, there will be a lot of rubbish. Okay, there are a lot of bacteria, dirt, and then a lot of these flies coming over. So it becomes an unhygienic environment. So the bacteria will grow, cockroaches will come. Okay, so it's the same thing that happens in the urinary tract system. So if let's say there are any blockages, there's a tendency for the bacteria to grow because the urine has been stagnant for quite some time. Alright,
Yes.
and
So, lastly, as Jeremy mentions, the use of diaphragms, condoms, and spermicides for birth control during sexual intercourse will kill the good bacteria. For example,
Yes.
in vagina we have this lactobacilli, this flora balance helps to keep our vagina the
Healthy.
correct acidity, and also can helps to prevent you getting UTI. So if you keep using spermicide, it will disrupt the balance of the lactobacilli.
Yes.
So it will also leads you to higher risk of getting UTI.
Yes, correct. And also some studies found that if someone has actually just gone through a sexual intercourse, it's very important for the lady to immediately go to the toilet, okay, to pass the urine, so that when you pass the urine, it can actually help to flush out those whatever bacteria that has been attached to the urethra. So it actually reduces the likelihood of getting the UTI, or even to prevent the bacteria from traveling up to the bladder or even the urethra.
Yes. So we always say prevention is better than cure.
Yes, as
so
always.
for cure, the treatment for UTI we know is almost about antibiotics.
Yes,
but sometimes if you keep taking antibiotics, it will kill the good bacteria in your gut and disrupt the balance of the microbiota in your gut and in your vagina. So sometimes we have to take some precautions, preventive measures, and here we have some tips for you to prevent UTI.
Yes, correct. And we all know that when it comes to UTI, okay, it's not just about the medications, of course, it's also about your dietary changes and of course your lifestyle changes. So what are the do's and don'ts that we have to look for is the number one don't is do not use scented soap, okay, or feminine hygiene products.
I think it's especially to ladies, because ladies, some ladies, they will think that if they use those fragrance soaps or these genital products, they feel fresh, they will feel very clean. But actually, it will the fragrance, some type of fragrance will irritate
Yes,
your
correct.
urinary system, and if you use it too frequent, it will disrupt the pH, flora balance in your vagina, in your urethra.
Correct. And next also we have do not hold your pee if you have the urge to go. All right. So imagine, actually for guys probably we are not that particular, but because ladies they are a little bit particular about the hygiene, especially when they are going out. So don't worry, probably you should actually keep some sanitary wipes, okay, with you. So if you go to public areas and you have concern, probably you need to sanitize the area, okay, before you use the washroom. It's better than you hold the urine, all right, because you do not want to actually put your risk higher, especially for ladies, okay, post-menopausal, okay, if they are above 50 years old, your risk of getting UTI is even higher, okay, compared to when you were younger.
Yes. And next, don't wear tight synthetic underwear such as nylon. So you know, nowadays there are many nylon underwear because I don't know why it's a little bit of cloth and maybe it looks pretty, but if you wear too tight, then actually it will trap moisture around your urethra. Then the moisture will be favorable condition for the bacteria to grow.
Yes.
So if you can try to switch your nylon underwear to cotton underwear because it can allow more.
Breathe.
Your body can breathe.
You need the ventilation, okay? You do not want the area, your groin area, to be very hot and humid. So same thing goes to guys, alright? You have to make sure you have to protect the environment so that the area is well ventilated, okay, to prevent any growth of unwanted bacteria.
Yeah. Next one, don't drink alcohol, coffee and caffeinated drinks, and also don't eat too much of sugary food or drinks.
Yes, correct. Why do we mention coffee, alcohol, this? Because these are what we call as stimulating foods, okay? Or they actually tend to be recognized as bladder irritating foods, alright? So these foods can actually trigger your bladder to be very sensitive, alright? And it can actually changes the pH of your urine as well. So we do not advise you, especially if you already have UTI or recurrent UTI, you have to, of course, avoid drinking all these in excess.
Yeah, and for sugar, don't overconsume sugar drink or boba tea or those teh tarik with a lot of sugar.
Yeah.
Because you know we like sugar, but the pathogens, the bad bacteria, they like sugar as well.
Yes, correct. And some studies also found that when it comes to diet, okay, you have to look out for people who are carnivore and they tend to eat a lot of pork and poultry. Okay, why is it so? Because some studies found that they actually took these urine samples from people with this UTI, alright, and then they actually get the bacteria and they look for the E. coli, and they notice that this E. coli is very similar to the E. coli found in poultry and pork. Okay, so these pork and poultry, because they are reservoir for the we say these E. coli, and when we eat these foods contaminated with the E. coli, it can actually goes through our intestine and leaches out, okay, into our bloodstream and causing a lot of this UTI. So imagine this was actually a study also done by China, where they actually had 9,000 people who are Buddhists, alright, and they practice a full vegetarian diet, meaning they omitted all the animal food products, including the poultry and pork. And they actually found that this group of vegetarians, okay, they followed them for 9 years, and they noticed that they actually have a 16% lower risk of developing UTI than those who are non-vegetarians, or those who are already eating this poultry and pork. So it's another good time or good advice for us to reduce the animal food intake and switch to a more healthier plant-based diet.
Yeah, because we always heard of like practicing a vegetarian or vegan diet can lowering your risk of getting those cardiovascular health issues.
Yes, correct.
Chronic issues, but we don't know that actually it is also beneficial to our urinary tract.
Yes, correct. So it has a lot of this influence also on your gut microbiota. That means the good flora, the good bacteria in your gut. So the good bacteria in your gut will also affect how susceptible is your bladder or your urinary tract to all these kind of infections.
Yes. So the last don't will be don't use condoms or diaphragms
with spermicide loop. So as what we mentioned just now, spermicide loop meaning that the loop actually has a gel that kills the sperms, okay, or the seminal fluid. So this will actually alters the pH or the acidity of the vagina. And of course, it can actually alter the what we say, the microbiota, the flora and fauna, flora balance in the urinary tract area.
Okay, so after don'ts, now we proceed to the do's. So the first one, always empty your bladder.
Yes.
I think it's not very easy, isn't it?
Yes. Normally, I would say depends on how much water you drink, and of course, one of the ways to prevent UTI, as what we mentioned over here also, is to drink plenty of fluids, because the more water you drink, okay, the more urination that you need to do, okay, and actually helps to flush out the bacteria that attaches to the urinary tract walls. But if let's say if you go to the washroom around 2 to 3 hours every one, so I think it's actually okay, alright, as long as you don't wait until like 6 or 8 hours then only going to one. So it's very difficult, because sometimes when people they are on the road, right, and then afterward probably they are in traffic jam. Yeah, so it's very difficult, and they actually come up with a lot of these weird theories or ideas of urinating as well. So you have to find a way for you to release your urge.
Certainly easier for men. Women have a lot of problems actually.
Yes, correct. But always keep in mind, if you are expected, during the hours, probably you have to reduce drinking those irritating food. Okay, for example, like coffee and tea. Because coffee and tea, they are known as diuretics. Diuretics meaning they promote more urine production. So if you know that you're expected to be in a jam where you have very limited access to toilet, please refrain from these foods, okay, during that particular time.
Okay. Next one, keep the genital area clean and dry and wipe from front to back when you go to toilet.
Yes, so this is what we have mentioned just now to prevent bringing the contaminated feces, okay, from the anus to the vagina or even the urinary tract area.
Yeah. And also wash the skin around the vagina with water before and after sex, and even peeing. Some people, they will pee after sex.
Yes, correct.
And so promptly change nappies or menstrual pads if they are soiled, so it is keeps your area clean to prevent the bacteria have the chance to flourish and attach to any parts of your groin area.
Yes, correct. And next we have drink plenty of fluids and particularly water, because as I mentioned, the more water you drink, the more urination that happens and actually help to flush out the bacteria. And lastly, to eat more antioxidant rich foods such as cranberries and probiotic foods. Now when we talk about antioxidant, there's a specific antioxidant that we need to look for is the proanthocyanidin. Okay, it's a very long name, but we call it as a PAC. Alright, now this PAC, how it works is actually helping you, okay, to imagine just now we mentioned the urethra. So there are possibilities that these bacteria called the E. coli, they will actually attach to these urinary tract walls. So this proanthocyanidin, okay, the PAC actually helps to flush out, okay, they kick them out from the urethra. So it actually prevents the bacteria from attaching, so thereby reducing the likelihood of UTI. So it's actually very common for doctors to advise patients, even though you're on antibiotics, okay, you can actually drink more cranberry juice, of course the unsweetened ones, or you can actually take cranberries, or even foods that are very high in proanthocyanidins.
So, and also with probiotics food, we know probiotics are good for our gut, and also actually for our urinary system and the vagina. We know that the vagina have a lot of this flora, no fauna, and then flora, and this they have to be in a balanced state. So the good one have to be in a balanced state so that your vagina, your urinary tract will be in a healthy state.
Yes, correct. And again, as I mentioned just now, aside from avoiding coffee and tea, you should actually avoid even foods like peppers, okay, or irritating ones, because it has been related to these uncomfortable symptoms, especially if someone has the bladder infection or the cystitis. Okay, so remember, if you have all these issues, it will be better for you to avoid, okay, or to reduce the intake of all these irritating foods.
Yes, so in conclusion, it is true that women actually are more prone to getting UTI, but we have to be aware, and if you found out that you may have these signs and symptoms, remember to look out for your doctors, your practitioners to identify the issue so you can get right cure.
Yes,
treatment.
correct. And as what we say, prevention is always better than cure. And if you already have once UTI, okay, do remember to practice extra precautionary measures so that we don't get ourselves with recurrent UTI, okay, and don't be your own doctor, okay. Always get the most professional advice that you can. Alright, so I guess that's all for our sharing today. If you enjoy our sharing, don't forget to like, comment and share with all your friends and family, especially your lady friends, okay, if they are already having these issues of UTI. Alright, and of course subscribe to our channel because you'll get notified when we have these live or even these premiering channels.
So that's all from us. I'm your nutritionist Wen-Xin.
And I'm your dietitian Jeremy.
See you in the next session. Bye bye.
Bye.